Hi there, my name is Zach. I am going to be demonstrating the process for administering injectable medications. Our patient today is Manny Stickins. Patient's date of birth 12/15/48. His MRN 73421. Today we're going to be administering, and he has an allergy to penicillin. Today we're going to be administering demo dose, 0.8 milliliters intramuscularly. We're going to be giving insulin R, 7 units subcutaneously, and insulin N, 14 units subcutaneously. This is a round of the 0900 medications, as well as we're going to be administering a one-time order of Practitube PPD, 0.1 milliliters intradermally, and then the results will be read in 48 to 72 hours. So first thing that we're going to do is we're going to come to the Pyxis, which is where I'm at, and we're going to grab our medications, verify them against the MAR. So the first thing we have is the pharmacy is dropping off medications to the Pyxis, and so we're going to go in and we're going to verify. So this is the Practi ampule of the demo dose. There is 2 milliliters in this, so there is more than enough for what we are administering. Oh, and the expiration on this is unlisted. Oh, I'm sorry, it's 02/2029. The next thing is we have the insulin R, so the Practi insulin regular. There's 100 units per milliliter, and this also expires in February of 2029. Next up, we have the Practi insulin NPH. This is also 100 units per milliliters, and this expires 02/2029. And then finally, we have the Practitube tuberculin PPD. There is 1 milliliter here, so that's more than plenty for our 0.1 milliliter draw. And then we will show here. So, N, tuberculin, and that. All right, so now that we have our medications, we are going to move on to the nurse's station. So once we are here, we're going to go back through, re-verify medications. So we have the Practi insulin and 100 units per mil, 10 milliliters. We're pulling 14 units. We have enough. We have the Practi insulin regular, 100 units per mil, 02/29. We have enough for our 14 unit or 7 unit draw on that. We have our Practi tuberculin, 1 milliliter. We have enough for our 0.1 milliliter, and then we have the one Practi amp 2 milliliter, which will be enough for the 0.8. So this has been verified a second time, and we can start gathering our supplies. So for this, we're going to need a few different alcohol swabs. We're going to need a 3 milliliter syringe, a filter straw, and we have a 22 gauge 1.5 inch needle. Those three will be for the intramuscular injection. We have a intradermal intradermal 1 milliliter syringe, and then we have our insulin needle. This would normally be in a wrapper. So we're going to hand hygiene and start getting everything. So first things first, let's go ahead and do the demo dose, the 0.8 milliliters. So in order to get that ready, we're going to break open the ampule. In order to do that, you're going to take an alcohol swab. Just toss that place this over top. First, make sure that the ampule has been flipped down, and then we're going to break away. And we're going to drop this into sharps. And then the next thing we're going to do, we're going to pop open the filtered straw. We're going to open up the syringe, and then just to make our lives easier, we're going to open up the intramuscular needle. We're going to remove the syringe and attach it. And then by carefully not touching the sides, we're going to come down. We're going to draw up at least enough for the 0.8. And I'm forming a small air bubble, which isn't a huge deal. We'll just pull past it. Okay. Then flip it around. We're going to dispose of this, and this would go into sharps, and then we're going to attach the intramuscular needle, and then we're going to dispose of the excess into the trash. Perfect. And we have the 0.8 milliliters. Let's place this back here. And then we're gonna grab a piece of tape so that we can label this via the triangle method. And then we're going to write and the expiration, which we're gonna confirm from here. Perfect. And I'll just show this before I tag it. Demo dose, 0.8 milliliter intramuscularly, expiration 02/29. There's my lovely tag. And then next up we have the insulin, and then now we can dispose of this into sharps. And then next up we have the insulin. So for this we're going to follow the order of cloudy to clear, then clear to cloudy. So in total we're drawing up 21 units. And then before we can do that, we're gonna just roll our insulins, make sure that they're well mixed. You don't wanna shake them and agitate it and add a whole bunch of air bubbles. So roll, roll, roll. And then before drawing up the medications, I'm going to use an alcohol prep pad. We would wipe these down each for 30 minutes, or 30 seconds. 30 minutes would be excessive. So wipe, 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 30 seconds. And then I would use a different pad. Wipe, 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 30 seconds. We can toss this. And we're gonna take this and we're gonna go air first into the cloudy. And we are just verifying it's 14 units of the NPH. So we're gonna come down to 7. Okay, and then we're gonna go into regular, the clear. We're gonna inject the 7, and then we're going to flip this and draw up 7 units. We're gonna remove this, and then we're gonna go into cloudy. We're gonna drop the 14 units to equal 21 units. And then using a safe method, we're going to recap this. I put it on the right way. And then we're gonna pop this back in here while we write up our triangle method. And then for these, we're gonna have insulin R. For insulin R, we had 7 units. And the expiration is February 2029. And then for this, it was 100 units. Per milliliter. And then insulin. And we have 14 units. Sub Q 02 2029. And this is also 100 units per milliliter. And then without obscuring the plunger, insulin RN 2029, 100 units per milliliter. Got cut off just a little bit. And then we have our Practi tube. So this is going to be a similar situation. We're going to grab an alcohol pad. I'm gonna wipe this down, 30 seconds. And then we're gonna take this needle and we're just gonna confirm, yep, 5/8, this is okay. We're gonna pop this open. And then we're going to draw up 0.1 milliliters. We're going to uncap and insert. We're gonna have to back out just a titch. We're gonna draw, so this is 0.1. Apologies, getting a little bit of air bubble. Going to safely recap. And I'll show you here, 0.1. And then just to confirm, I did have the 21 units of insulin. I'm gonna draw this up in the triangle method. For this, we'll have the Practi tub, 0.1 milliliters, and then the expiration on this was 02/2029. It's gonna be we have the Practi tube, 0.1 milliliters, and the expiration is February of 2029. So now that we've pulled the medications, they've been verified, everything's ready to go. This will go back to the Pyxis. We are going to take this to the patient's room. So here at the patient's room, we've got our medications here. Mar, come in. Hi, how are you doing today? My name is Zach. I'm going to be your student nurse giving you your injections. Before we get started, can I just have you confirm your name? Thank you so much, Manny. And then, Manny, can I have your date of birth, please? 12/15/1948. Perfect. Thank you so much. And then just confirming the MRI match. Everything looks great. So the first thing that we're going to do is we're going to administer the intramuscular injection. So for that today, we will do the right ventrogluteal. Gloves are a little small. Oh, they are the small size. Okay. So I would put gloves on. I'm going to keep the glove off of this hand right now because these are very tight and uncomfortable, but I would have gloves on. I'm just going to go back through and verify. So we've got the demo dose, 0.8 milliliters intramuscularly, and this is not expired. Next up, we have the insulin. So insulin R, 7 units, unexpired, 100 units per milliliter. And then when we have insulin N, 14 units, both of these are going to be subcutaneous. This is not expired, 100 units per ml. And then finally we have Practi tube, which is going to be 0.1 milliliters, which matches, and this is not expired, so we are going to go for all three. And I'm actually going to take this off because I can barely move my hand. So first up we're going to do, so I've got gloves on. Cannot stress that enough. I have gloves on. We have the demo dose, So, and this feels weird without gloves, but we would take the demo dose. We would identify our site for the right ventrogluteal using the 3-hand method. And then what we're going to do is we are going to take the cap off. We're going to inject at a 90-degree angle. Oh, first, I'm so sorry. I did not do that first. Pretend like that did not happen. We first took an alcohol swab, wiped it down with an alcohol swab for 30 seconds. Make sure that it is as clean as we can get it. And then, fast forward back in time, we're going to inject at a 90-degree angle after spreading the skin. Before injecting, I can't stress this enough, before injecting, you're going to aspirate by lightly pulling up, ensuring that blood is not coming up. As long as you don't see blood after aspirating, you may inject. Perfect. We're going to withdraw this. There may be blood present. After injecting, you're just going to want to apply pressure. You do not want to rub it, but just apply pressure. Oh, and I'm not going to recap this. This is just going to go straight into sharps. I just hate doing this at home. But I digress. We have the insulin, 7 units, 14 units equaling the 21 units that we have here. For this, we're going to pick the right lower abdomen. Abdomen is the best place to administer insulin. And then for this, we're going to see if we can pinch an inch. Wow, this gentleman's fairly lean, so we cannot, and I'm going to have to inject at a 45-degree angle. So again, we're going to remove the cap. We've wiped the site down with an alcohol swab, and then we're going to inject at about a 45-degree angle. Apologies. It's going to be in at a 45-degree angle. And we're going to inject, remove, and then we would apply pressure, not rub. And then this is just going to go straight into sharps. And then finally, we have our Practitube injection. And then for this, we're just going to do the right, let's go ahead and do the right forearm. So for this, we've got it. This has been verified. We're going to wipe down the surface. Remove the cap. And then we're going to spread for this. We're going to inject at a 10 to 15 degree angle with the bevel facing up. And the goal here is you want to see a bleb on injecting. So this practice skin is very thick, but it would normally be just under the surface. So we're gonna take this, and this is gonna go into sharps. And then I would sign off and verify that I have completed this as such. So complete, complete, complete. And then we're gonna write in our time, 0900. It is complete. The demo dose was administered in the right ventrogluteal in my initial. The insulin was administered into the right lower abdomen. An initial on both. And then the tuberculin was in the right arm. And I'm gonna initial. And then I'm gonna sign. Zachary Smithley. SCC SN. And I would clean up. throw my trash away. Mr. Stickens, is there anything else that we can do for you? Is there anything I can get you? All right, thank you. Before leaving, I'm going to assess, make sure that the patient's bed is lowered, make sure rails are up, make sure that the patient has access to call light.